Hello, everyone. I'm Jim Garrison, and I want to welcome you to day 339 of Humanity Rising on this day of October. And I want to announce a very sad development over the last few hours. Avon Madison passed last night in Marin County, north of San Francisco. She was 80 years old. Many of you know Avon and knew her over many, many decades as a tireless campaigner for peace and human tolerance and mutual respect for one another. It was Avon Madison who was instrumental back 30 years ago in getting the United Nations to declare September 21st every year as an International Day of Peace. And her longing over the decades was that we develop scholarships to enable people to study peace. So as many of you know, last month, during the 11 days of global unity between 9/11 and September 21st, we opened the 11 days in honor of Avon. And we awarded 11 scholarships to a master's program at Ubiquity University on tolerance and peace studies. And Avon spoke to us, and we all, with one accord, honored her and her purity of heart, I would say, and complete clarity of dedication around world peace. I know many people, but I don't know anyone who was more dedicated day by day, year by year, decade by decade to world peace as Avon Madison was. And she radiated that from her being. And when you were with her, she just embodied that purity of intent and sincerity of heart that brought you into a calm, benign, pacific place. So I just want to bring the spirit of Avon. As many of you know, death, like life, is a process. So when one begins to leave the body, according to many ancient traditions, it takes about 3 days for the death process to really complete. And in the Tibetan Buddhist tradition, as you know, it takes 49 days for the soul to really leave the body and go into what they call a Bardal state and begin the process of the transformation, the transmigration of the soul into its next incarnation of being. Because death is a doorway, and through that doorway is a great mystery. And it is incumbent on those of us who are still living in our bodies that when a great soul passes, to hold them and care for them and love them, to ensure a community support, a container for them as they move into the next more rarefied, essentialized level of life. So as we do our meditation today, our heart coherence meditation, let us hold Avon Madison as she begins her journey into the great mystery, as the permutations of life in the cycles of being manifest through her in a powerful, ongoing way. So let us take a minute. Let us center ourselves in our bodies. Let's feel the aliveness of our bodies. It's so extraordinary when, if you've seen anyone die, in an instant, the body becomes inert. So just feel the aliveness of your body today. And attune yourself to your heart, if you can. Let us just for the next minute or so attune ourselves to our hearts in a vital body and consecrate those who pass. Thank you, everyone. Now with an open heart and a heart filled with gratitude and love for certainly Avon, but all of you who have joined our session today, let us, in a spirit of compassion, in a spirit of wholeness, turn to our subject for today, which is health. From the very beginning of Humanity Rising, which emerged out of the pandemic, we dedicated ourselves to continue our broadcast for as long as the pandemic endured. And here we are 18 months later. The pandemic is still very much with us and has affected public health all over the world and affected mental health, spiritual health, and claimed the lives of millions, and is still not over. So Lars Münter from the Nordic Health Movement 2030 and David Somekh from the Europe Health Future Forum have convened a number of panels on various dimensions of health, mostly localized in Europe, but also with global implications and ramifications. So David and Lars, deeply grateful for the way you have just curated our health sessions and domain on Humanity Rising. And this is the fourth of 5 sessions they are planning will conclude next Thursday. But David and Lars, I turn the program over to you with deep, deep thanks for everything that you've done.
Thank you so much, Jim, for the opportunity. Lars, do you want to begin?
Well, yes, thank you, David. It's been an interesting journey to talk about health in the midst, of course, of a pandemic. In a way, we'd rather not, or rather we'd wish that the circumstances were different. But it's been a pleasure so far to talk about health with a lot of different experts from various fields. At this point, what we haven't done much maybe is to focus especially on, well, we focused a lot on the future of health, but we haven't maybe talked too much to some of the people that will live in much of that future. I sometimes tease David. You might remember that he and I may not be exactly the voice of the future, although we try. But today, at least, we're trying to make amends, and we have invited a number of what we call young voices, and we beg their forgiveness to label them so. but still, in comparison to our other great esteemed speakers, there will be. And we look forward, of course, to hearing their perspectives from their professional viewpoints, their personal experience on what they consider to be parts of the future of health, as they will be working, living, and breathing in. To add, David?
Yes, and I just only would add to that. I've spent time over the recent years talking to younger people. Most people are younger than me, but I mean, particularly, whether you call it Generation Z, I don't know if you got that right, but anyway, people under the age of 35 or whatever, and just asking them, you know, how do they see what we do, and so on and so forth. And there's no doubt that younger people respect our experience and whatever wisdom we have. But there is still a strong tendency in systems in our society, health isn't the only one, education you can think of and others, where there's this still residue of paternalism, where the idea that older people should actually listen to younger people doesn't work quite so well as it might. And we think it's really important to redress that balance. And we're very grateful to this group of folk who came really quite at the last minute, really. It's partly our fault, but delighted you can come and to listen to your views about the future of health. So shall we kick off? I'll ask, first of all, Rosie Atak, if you don't mind opening your video. Hi. Look, Rosie, as we agreed, the procedure here is simply if we ask you just to say a bit of who you are and where you're coming from, kind of thing, and then a little bit about your thoughts about the future.
Sure, yeah. Hi, everybody. My name is Rosie Atak. I work for the Good Governance Institute and I'm based in London. So I've got a degree in biomedical science. My history is quite, my background is quite health focused. So degree in biomedical science, then a master's in health humanities. And during my master's, my work kind of broadly focused on health inequality and health policy. I've got a tiny bit of experience working in the NHS, and I've done a research project for looking at dementia care for a domiciliary care provider. I guess for me, there's two main areas that I really want to speak about in relation to the future of health and healthcare. They're both quite similar. There's a lot of overlap, I think, but they've both been very much highlighted and pushed to the centre stage in the past few years. And so hopefully that will lead to a lot of change over the next, 10, 20 years, however long. I think COVID has very clearly highlighted that health inequity within nations and between nations is just huge, and a lot of that is leading from social and structural inequalities. To tackle these health disparities and generally improve health, I think we desperately need to improve the social inequalities that are just so rampant in this world. We talk about the social determinants of health and to mean conditions in which people are born, grow, live, work, age, as well as the structural forces that then shape those conditions. So really, in order to reduce health inequality and improve population health in the future, we need to, implement a proper living wage that increases with inflation. We need to ensure that everyone has access to safe, good quality, affordable places to live. We need to make sure that wherever you live, there's good quality, cheap, reliable public transport, good quality schools, good air quality, job security, access to good quality, fresh food, and time to actually cook it while you're not at work. The list really, really goes on, but I hope I'm clear in the message that health is so much more than simply healthcare. And the only way to tackle these rampant inequalities in health is to also tackle it everywhere else. And that's quite simple, right? We'll just start there and move on. But I think, practically from that, integration is really important. Hopefully what's begun in the UK with, in England anyway, with the transition to these integrated care systems, will go some way to acknowledge this, and then go some further way to actually making some change in that area. I think public and third sector organisations across the board should be working collaboratively with these shared aims of improving people's lives. That very much has an impact on health. So integrated care systems are still very much in their early days, and in due course we'll see how effective they actually are. But if successful, I think they could be really a step in the right direction that can then be built upon and improved in the future. Another thing I just want to touch on is probably very overdue, but rightly on the public agenda now, is diversity and representation. It's specifically in my mind, that's in relation to medical and biomedical research. So historically, a lot of research was carried out on, the participants were all kind of straight white men. And this leads to just hugely skewed data. So that sample is not representative of the population. And then when that data is extrapolated, it's just not really valid. So a more diverse and representative research will lead to valid conclusions, for one, but also to then much more effective care. Our understanding on a range of conditions may well change a lot over the next 10 to 20 years because there's so much different research going on now. And that's also true of the people who are carrying out the research. Again, historically, the same kind of group of people, but that's now becoming a lot more diverse. I think in the future, we'll have a much better understanding of many different conditions, which they've always been an issue, but they just haven't been properly researched or maybe taken seriously because the people that have been affected by them haven't had a seat at that table and haven't been able to shape the direction of the research. But that has changed a lot in the last few years, and I think that will have a really big impact in the future. I personally think a big area where we'll see a lot of that change is around sexual and reproductive healthcare. We're only just really starting to get some really interesting research into conditions like PMS, PMDD, things like that, which for a long time were really just viewed as women overreacting. And now we know they're very serious conditions, and the research is happening now. And along with sexual and reproductive healthcare, there's a lot of shame and stigma still. And I know there's a lot of work now going into breaking down those stigmas, having those conversations. I'm thinking specifically about, there's a lot of work going into breaking down HIV stigma. We've got U equals U. So with any luck, people in the future will feel a lot more comfortable having those conversations, accessing care they really need because there'll be less stigma. And in a similar vein, I think and hope we'll see the end to race-based medicine. So I know that a lot of hospitals, some hospitals in the US have stopped adjusting readings for the glomerular filtration rate according to race. So I'm not entirely sure who the makeup of the audience will be, but I'll just explain that in case people aren't sure. So there was this theory that Black people generally had a lower kidney function rate. And so if you kind of tick Black on your hospital intake form, then the acceptable values for your kidney function test readings would be lowered. So that means that if a white person and a Black person go in, have the exact same test, have the exact same reading, the white person, if the acceptable rate kind of readings are here, they're underneath it, so they're going to get treatment. But for the Black person, the exact same reading, the acceptable things are here, and they're going into it, so you're not going to get the treatment. And I think you can see that clearly adds to this inequality in health outcomes. So by the time the Black person's kidney function is reduced to the level where they're going to receive treatment, that treatment can be less effective, the outcome is worsened, huge inequality. So as I say, some US hospitals have stopped doing that, and hopefully the trend will continue much more widely for other things. A big area where that I think is an issue is maternity and maternal outcomes. There's big racial inequality. So I really hope that with the research, these gaps will close and more positive outcomes will happen across the board. So there's quite broad areas. I hope that we'll see a lot of progress in the future. There's some really, really amazing work and research happening right now. So that will take some time to get put into practice. And then, hopefully there's some changes I would love to see.
Indeed. I love the phrase, that will take some time. I think maybe you have quite a lot on your menu on the to-do list, which is amazing. But clearly, of course, in a way that will probably not be done by next Friday. So, and given all these topics, one thing that I'm curious about is actually when you say we should, who's the we?
Oh, tricky. I think politicians have a big part in everything, researchers, it's huge, but you need the platforms as well to really kind of build up that research and to publicize all that knowledge. So I guess as well, you're talking industries who can fund the research would be another big part of it. Everyone.
Everyone, yeah. And the role of the social movements and the role of civil society. Do you think that that this is a role that they're ready for?
I think more ready now than ever before, but I don't know if that means 100% ready. I think a lot of people are. there'll be a lot of convincing to do, as always, but I think we're now in a better position than we have been before.
And then the governments, are they ready for that collaboration?
I don't know much about all of the governments. I'd say the UK government has a long way to go, a very long way to go. But hopefully some of these things can happen from the bottom up and from other directions, because I think if we put all of our faith in the governments, things won't get done.
That's a quote. David?
I mean, you've packed a hell of a lot into those few minutes. So thank you very much. They're very, very well made points. So thanks for that. Let's move on and turn now to Brian. Do you like to open up your screen? Hi, Brian. Please introduce yourself and then tell us your view of the future.
Absolutely. Thanks, David and Lars, for having me. So hi, everyone. I'm Brian Wong. I am Canadian, currently based in London. I'm an entrepreneur, public health advocate and practitioner, and a multidisciplinary researcher. My major interests are in aging, life course, digital health, global health governance, and youth engagement. My background's in biomedical science, epidemiology, and global public health. And I wear several hats, the primary one being as youth officer for the Lancet and Financial Times Joint Commission on Governing Health Futures 2030, Growing Up in a Digital World. I suppose is quite an apt title given the scope of this session. So as part of that role, I work to bring youth voices to the table to explore this convergence of digital health and AI to support the achievement of universal health coverage and the third Sustainable Development Goal, which is health and well-being for all. At the international level, I'm on the research committee of the WHO Global Health Workforce Network Youth Hub and the steering committee for the new WHO Youth Council. At the European level, which is the focus of this session, I'm involved with ASFER, which is the Association of Schools of Public Health in the European region, as part of their COVID-19 task force. And I'm also on the steering committee for the European Public Health Association Digital Health section. At the national level, I've previously acted as a surveillance epidemiologist, supporting Public Health England's Immunisation and Countermeasures Division in its national COVID-19 surveillance efforts. And I'm a big proponent of this Think Global, Act Local mantra, which urges people to consider health of the entire planet, but to take action more concretely in their own local communities and cities. So I'm currently undertaking the Social Innovation Fellowship, and I've taken on this role of digital team lead for a group of GP surgeries in East London, which is currently undergoing a lot of digital transformation to balance their supply and demand, to better accommodate the needs of patients, in this move towards more personalized care, and to ultimately improve patient satisfaction and outcomes. Rosie touched on these integrated care systems, and the work that I'm doing here is just a small slice of that pie. And I have an underlying strong passion for meaningful youth engagement and empowerment, which led me to do a lot of work in capacity building for students and professionals. I know in a little chat with David, he asked me to touch a little bit on the Commission's work because not a lot of people might have heard of it. So I'll just quickly do that before I dive into my hopes for the future. So the Lancet Financial Times Commission, which I'm a part of, as I mentioned, is exploring this convergence of digital health and AI and other frontier technologies. But it's primarily focused on ensuring healthy lives and promoting well-being for all at all ages, particularly that of children and young people who are growing up in this increasingly digital world. We've brought together 19 independent commissioners from all around the world, different range of sectors and disciplines. And the objective of this commission is to deliver a clear set of recommendations on the governance of digital health, taking into account geopolitical, economic, and social factors. Rosie brought up the social determinants of health. We're also shaping up a definition of digital determinants of health and health data governance principles, which would feed into this. And we've got a forthcoming report launch on the 25th of October at the World Health Summit. And our report focuses on these digital transformations of health, youth health futures of growing up in a digital world, and ways to shape health futures by addressing digital divides. Rosie mentioned these health inequities, and a lot of these are have been exacerbated by digital divides. And we focus on examining integrated policies that are being developed around the world to identify which of these have the greatest potential to improve health and well-being at all ages, while also ensuring human rights and maximizing health equity. And the Commission is really aware of this important role that youth have in reaching this sustainable health future. We've brought together a group of fellow youth here to discuss, and I think it's worth mentioning that today there's 1.8 billion people between the ages of 10 and 24, and that's the largest youth population in history. 90% of these are living in developing countries, and this population really represents an unprecedented powerhouse of human potential and digital engagement, which could really positively transform the future of health and sustainable development. We've seen, because of COVID, youth have demonstrated innovation and resilience in harnessing digital expertise to really build community and remain connected and creative throughout the pandemic. And we've been, as a group and demographic, youth have been disproportionately impacted by the pandemic. So we're talking about bringing youth and having them have seats at the table, and we really should be, and we being everyone, a whole of society effort should be regarding youth as key agents of change and experts in their own health and well-being. So I'll just move on really quickly. So I think I've got a couple of concerns around the health of Europe, and a lot of these surround the mental health of European citizens, whether as a result of climate change or COVID. And I think for a healthy future in Europe, requires one in which all European citizens, children and youth in particular, as their health features are most at stake, that they are meaningfully engaged in the design, development, implementation, and evaluation of policies, programs, services, and tools which would have an impact on their health. And I envision this healthier future of Europe as one in which everyone has requisite digital health and civic literacy skills to engage in all these different processes to benefit from any new health solutions which might arise. And as I mentioned, a lot of the pandemic has facilitated a lot of these positive changes, which we're slowly beginning to see being embedded in society. And I think to unleash this full power and potential of data and the digital revolution to deliver better healthcare systems, we need more trust in government and health systems and big tech. We've got more data than we know what to do with, so ways to really harness that data as well and to address a lot of these challenges in governing health data and data for health. So I'll stop there, and I'm sure a lot of our discussion will build on these points.
Probably will, indeed. We need more trust. And pardon me for asking a complicated question, but it is a simple thing, trust, in a way, but it's not really something that you can mail order, which would be nice, I suppose. But how then? I guess I agree, but how do you find it, build it? It's not like truffles either. But it's very elusive. Any ideas on that one?
I think, as I mentioned, I think one of the big components of this is engagement, right? So engaging people with who are going to be working within these systems. I think in order for, and I'll stick to talking about health data governance. In order for health data governance to reinforce trust in data systems and data use, it really needs to prioritize, transparent processes and systems. Really need, consumer buy-in. We need people to have informed consent. They need to know, who's accessing their data, what's being done with it, and to have that option to say no, to be able to say, no, I don't want my data to be used, for instance. So I think once you give people agency over these kind of processes and things, that they can control, feedback into, as well as, have institute these feedback and accountability mechanisms for those people who are actually governing such processes. I think those are concrete steps forward for building trust.
And another question. Of course, seen from Europe, as you talked about European health, seen from Europe, that big continent north of Mexico can seem like one big place as well. But of course, there are huge differences between Canada and the US. Yet the point you made about European health, is there a difference then between those elements that are needed to build the future of health in Europe, and then the elements that are needed maybe in either Canada or the US? Or
Yeah.
if there are, what are those differences?
I mean, I think one thing that we've noticed, especially with the pandemic, is that we're experiencing a lot more similarities than we are differences, right? We've come together as society to know, that these are shared challenges that we face. Focusing on Europe, I think we've got this European EU health data space, which is coming in place, and I think it's long overdue. And that system would really support primary care and developing new treatments, medicines, medical devices, and services. And I think, of course, there's a lot of challenges that remain around how decentralized and disconnected EU member states are from one another when it comes to healthcare. There's a lot of clear limitations in the current system. And a lot of these challenges do need to be implemented, for it to effectively and fully realize the potential benefits for society as a whole. But I don't think it's so much as the what, but the how. And it's any of these decisions that are taken, really need to fully consider end users' concerns and needs. So I think, as to answer your question simply, we're seeing lots of similarities, and I think there's a lot of cross-country learning that can take place.
A lot of potential in co-creation. David?
Yes. No, I agree. I think it's very interesting. And absolutely, I took your point, Brian, about education, how vital that is. I suppose we're aware, isn't it, that for all the benefits of the digital world, there are also manifest dangers, which we also have to teach our young so that they can navigate all of that. I suppose it's like learning to drive a car, isn't it? You have to recognize there are risks as well as benefits. But just one thing I just wondered about, clearly because of your interests, although they are quite wide, you focused on digital, but do you have a vision of other ways in which how we approach health will change? I mean, Rosie talked much more globally about, it's not that I'm sure you buy it, about holistic view and the need for society as a whole to change, really, to make this all work. But do you have a particular interest in how other things might evolve in time?
I think digital, for me, the reason I focus on digital is because we've seen so much of it and because of the pace of change that digital brings. However, I think it is also important to caveat that digital is not always the best solution, right? The most high-tech solution might not always be the best. And what we've seen as a result of the pandemic sometimes is when everything suddenly switches digital and there's no governance mechanisms in place, there's not enough infrastructure, then a lot of people are kind of stuck on the wrong side of that digital divide. So I think a lot of these underlying factors, a lot of these underlying socioeconomic, social determinants need to be addressed before we transition and make those transitions to digital. So that's kind of where what Rosie was saying around the whole society efforts and addressing social determinants really comes into play.
Yeah, I guess we could have another debate as well about how you balance the digital benefits with the benefits of the human interface, isn't it? But that's maybe for later on or another time. But look, thank you very much. Let's move on to our next participant. Why don't we ask, going across to Belgium, ask Susanna Kishon, if you don't mind opening your video and joining us. Hi.
Hello, my name is Susanna. I'm a quality manager at a hospital here in Brussels. I'm Polish, but I live here. I studied geographical sciences first, and then after that I moved to health. So I first did a master's in global health, which really showed more of the governance of health at an international level. And then I moved to a master's in healthcare policy, innovation, and management. So that was much more hands-on management and smaller scale. So obviously, having studied geography as well, I have a particular interest in the effects of climate on health, the environment on health, which is a big interest for me. And so now I work at the hospital. So I work mostly with quality indicators, and I'm also preparing the hospital for the accreditation process. So that's what I do. The future of healthcare, it's such a wide question. It's difficult to squeeze everything into 5 minutes. But yeah, let me try to concentrate on a couple of things. So for me, we have made huge discoveries in the past centuries. We've made breakthrough discoveries in so many different areas. But somehow still, there are people who are dying every day from diseases that we know how to cure. So obviously there is a problem somewhere. And I think the problem is that we cannot put that into practice properly. So let me give you a couple of examples. So for example, we have health professionals, such as nurses, for example, who are completely demotivated by the healthcare industry. They come in to their studies very excited, and then they are really demotivated because they don't get any compensation for their work. So I think that's something that needs to be changed. Another example, for example, is that we know very well that health promotion is very important, and there are studies about that, but somehow it doesn't translate into policies around Europe. So, for example, I think it's 3% of the EU health budget that goes to prevention, which is really crazy when you think about it. And I think one reason for that is that obviously the politics are behind that, and politicians in general, they tend to look for shorter term solutions instead of looking way to the future, because they want, they want to have to be re-elected, of course. So so that's maybe one of the problems. And coming to prevention as well, I think that the Western medicine here is very much concentrating on specialists. So we have doctors who are very much specialized in one organ or one part of the body. And we lack this kind of holistic view of the human being. And I don't think it's a coincidence that now in Europe there is this growing appetite for the alternative medicines, because people they want that. They want to have a more holistic view, someone who would look at them as a whole. And so, yeah, that's kind of my battle, I guess, in the health area, is to create those type of integrated centers where you would have the benefits of both worlds. So we have this Western medicine that is so specific and so very much specific, and it works for some things, but then there are other things where you I think we would gain from exploring other options. So having centers where you would have both of those worlds would actually be great, I think. Yeah, I think I will stop here, maybe.
I don't know whether Lars is having connection problems, but
A little bit.
oh, you're not. Okay. You jump in then. Go on.
Internet connection, but it is kind of hard to though hear when you're not connected. So the brilliant point that you stated, Susanna, I missed some of them, but obviously holistic thinking is one that I can only agree with you that's very important. But I would actually ask David to ask the questions.
No, sure.
I would be wandering off into the wilderness a little bit here.
Okay. Look, Susanna, very interesting what you're saying, but tell me something. Of course, it's a cultural difficulty, isn't it, about integrating alternative medicines, because it's almost like people get into taking sides rather than looking to see how they might actually work with rather than work against, isn't it? I suppose that's partly just about the way that it's a kind of tribal behavior by the professionals. Well, they always mutter about there's not enough research evidence and all this sort of thing, isn't it? And yet people clearly want something. It's very interesting. But it's a long battle, but it's a good point you make. Tell me though about, I was curious when you started to talk about it, because of course it's true that despite all our discoveries, people are dying who don't need to, and obviously there are all kinds of reasons for that. But you actually focused on the remuneration of nurses and the fact that healthcare staff not feeling valued.
So I concentrated on that because that's what I see every day. I mean, I work at the hospital, so
fair enough. Yeah.
Especially with the COVID crisis. I mean, the politics during the first wave, the politics were all about re-evaluating the health budget and re-evaluating the importance of the healthcare workers. And I think there hasn't been any real change between then and now, and people are just exhausted, and it's very difficult to see that every day.
Yeah,
whether we're talking about burnout or just disillusionment.
Yeah, it's a lot of burnout, and yeah, there are so many job openings at the hospital because there's a lack of people who are interested anymore.
Yes, it's interesting. I was actually listening to, not that I do it always, but I was listening to the lunchtime news over my pita bread sandwich or whatever it was. But they were talking about exactly the same thing, and I thought some very thoughtful professionals were saying, and clearly it is a European, it's probably a global problem, but the biggest difficulty is you can't just, it's not a problem you can solve by just throwing money at it. And one of the things about the global shortage of healthcare professionals is the lead time for training. I mean, apart from the investment in training, which a bit like the investment in prevention, somehow never gets to be recognized for what it should be. It's a really what you call a messy problem, isn't it? Because if you're going to get more staff in, it's going to take several years, and we're talking about a problem that's acute, isn't it? It's going to be over the next winter and so on. It's really difficult, isn't it?
In my case, I guess either Susanna, you agree completely,
or you're frozen.
You're frozen. But I would say, of course, to add that one of the things that we looked pre-pandemic on would be the fact that a lot of Western healthcare systems are not really run in a sustainable way in relation to their human resources. There's been a deficit of doctors, there's been a deficit of nurses for ages. And we speculated before the pandemic what might cause that flow to stop. Well, one of them was not being able to travel. The other one may, as Susanna pointed to, disillusionment or suddenly being so fed up with a system that cries for your complete dedication, but seems not always to repay financially or maybe mentally either. But a slightly dystopian perspective as well, there might be in that as well. But let's hope that we find solution. I guess we should move on to our next speaker. And we're flying back to London, I think. We are racing across the channel once more. And in this case, we have Nahida with us, Nahida Abdulhamid. Nahida, are you?
Yes, I'm here.
Right? Yes, there. Yeah. So tell us again a little bit about yourself and also your perspectives on the future of health.
First, I just want to say such interesting conversations and so many points that were raised that were really interesting to hear. My name is Nahida Abdulhamid, and I come from a political background, actually. So in my undergrad, I undertook politics, and then in my master's, I did a development studies where we looked at health inequalities in the global south, dealing with health issues, development issues, and relating back that to the Western countries and see how we can somehow try help the global south in bettering their system and development in all aspects, including health. Currently, I'm interning at the Good Governance Institute as a policy and research analyst. Just like Rosie, I've worked on many projects in regards to the ICSs and looking at how adult social care sector is being dealt with, as we all know that many of the issues that adult social care sector are experiencing, for example, financial issues, workforce issues, are not being heard or dealt with correctly. So my research has focused on how we can bring their voices into the ICSs to deal with their issues better. But in terms of health and my views, I think listening to everyone, and especially being undertaking so much research, I feel like health has a clinical approach. And I think that is one of the biggest problems. And what I mean by that is we overcomplicate health. We never sit and just think, okay, what do we mean by health? So I think it's very important to firstly understand what we mean by health. Everyone has different definitions. And for me, I think it's physically, socially, and mentally being well. And also that being free from any form of illness. And we place a lot of responsibilities on health sectors. So what they do is deal with it in a clinical manner. For example, if you're obese, you go to your GP, they tell you you're obese. They prescribe you tablets. If you have high sugar levels, they prescribe you tablets. If you are sick, it's always very clinical. But there is a lack of focus on economic, political, and social determinants on health issues, which I believe Rosie has touched on. So there's 3 areas which I think there needs to be a much more focus on. For example, the neighborhood you live in has a massive impact on your health, i.e. obesity. You become obese for a reason. I live in Hackney, and I know that the area I live in, the only shops I'm exposed to is chicken and chip shops, which are not healthy living life or standard. These are the things my peers have access to, and it's really, really bad. If this is what we have access to, this is the only thing we're going to buy and consume, which therefore then affects our health levels, or in turn have health issues. And then we're also constantly faced with income issues. So we don't have, maybe many youngsters don't really have great jobs or great level of income, can't afford a healthy lifestyle. Organic food are very much expensive. So that again has an impact on the BAME community and their health issues. And these are not what NHS or health sectors are dealing with, because they're not looking at the root cause issues of health problems. And then we also have housing. In the area I live in, we live in shoebox houses. There's not enough spaces, especially considering the pandemic we've just experienced and that's still going on. One of the biggest things for me was this idea of, if you have COVID, then it's very important to isolate and staying in a room so you don't give COVID to someone else. But people that are sharing houses with their families or their friends don't have that space to isolate. So if I contract COVID, then it's unfortunate that maybe my sister will get COVID because we simply don't have enough space in the house to isolate. Again, that's not being dealt with. The health system or NHS or health sectors are not dealing with those issues. Employment, dissatisfaction, discrimination, housing issues, income levels, area you're living in. I think there needs to be a massive focus on this. And for me, my future vision is radical, is recreating the structure, recreating the system we're currently in, so that we place emphasis on where it matters, so that the health services we're receiving actually represents and is reflective of what the community needs. And there needs to be much focus on policy issues, which I'm not seeing much of in health sectors. And I think it takes maybe our community we need to build a community where these issues are raised and we understand health issues much better, and then maybe place pressure on the system or the government to hear us out, to hear the future generation out a little bit. A lot of these issues come from who's sitting at the top and who's creating these policies or these solutions to health issues. And that tends to be mostly a particular type of group from a particular type of background, white men, privileged, that have no clue what's going on in BAME communities. So it's not reflective of what they need. So definitely more diversity. The community needs to get together. We need to place pressure on the system. And if we don't have healthier young people, then I don't know what to say for the future generation. So this definitely needs to be something that's tackled head on, and something that the government just needs to start focusing on, which I'm not seeing at the moment, which is quite unfortunate. But sorry if I'm being pessimistic. This is my take on it when it comes to health, and it's quite scary to be living in such a moment like this.
Look, very well put. I mean, the thing is, I guess there are two things I picked up from you. One is, first of all, let's deal with the last thing you were talking about. I suppose there are moves in some places in Europe to have communities have more of a voice, to get politicians, those with power, to recognize what the needs of society are, rather than see it from above, as it were, looking down on the people, but actually sitting with them, isn't it? But it's a process that takes time to become regular, but it's essential, as you say. I wanted to challenge you, though. Of course, I absolutely relate to what you said about being in a neighborhood. Look, I've lived in all parts of London before I moved to the luxury place I live now out in the country. But the fish and chip shops, or the chicken and chips around the corner and so on. I mean, one of the issues there, of course, is a difficult one, isn't it? Because you don't have opportunity for a healthy diet, there's no doubt. But when you were saying about the health service just being clinical and just wanting to treat everything as if it's a disease, there is also the question of personal responsibility, isn't there? And that's, I suppose it's a question. I wonder if you have thoughts about how you support people in developing more personal responsibility as much as they can,
Definitely. No, I agree with you, David. Of course, it's personal responsibility. It's our responsibility to ensure that we're living in a healthy manner, always looking after our health. But I think that sometimes as young people, we don't have the choice to take responsibilities for our own health. So, for example, I'm sure that many people would aspire to live a healthy lifestyle, but it's just that maybe their parents or the backgrounds that they come from, it just means there's a lack of education in terms of what it means to be healthy, or this idea of affordability. What can you afford to help you take responsibility for your own health. What can your parents afford? What can your friends afford? What can your community afford? So definitely financial constraints and lack of access and education and information. Maybe if a solution could be working with anchor institutions, so like health sectors could be working with education systems or schools that can implement education surrounding health and what it means to live a healthy lifestyle, encouragement. So that could be an example, and then that leaves the students or the pupils to take responsibility of their own health. But I think there is definitely a constraint of financial constraint and educational constraint, in terms of being able to take responsibility for your own health.
I appreciate. No, I guess what you answered. I was thinking about that too. It's about what you call joined up society, isn't it? Where there are financial difficulties and so on, about how community support people. It can't solve it, but it can help people. Look, I'm very grateful. Let's move to our final speaker, and then we can have some time between us all. We're doing okay for time. So can we ask then, who have I left behind? Well, fancy that. We go over the channel again to Simone. And if you'd like to join us. Hi.
Yes. Hi, how are you? Good. Now I almost felt left out, but everything is good. Yes, so greetings from Brussels, Belgium. And just like to introduce myself and then give a few pointers of what I see as the future of health and where it should be heading. I actually will focus my little intervention more on what needs to be done first in order to really benefit from the future in health. So please bear with me on this. I'm actually working as a policy officer and negotiator for the European Hospital and Healthcare Employers Association. So when I was hearing earlier about the health workforce issues and working conditions in the sectors, I was a little bit triggered. So I will not really focus on this. So having more than one hat. So as the officer as an employer's representative. And then, of course, me as a public health professional. So within HOSPEEM, the Hospital Employers Organization, where I've been working for the past 4 years, I actually work on a variety of issues, and I think they're all really related to how we can address this in the future as well, such as occupational safety and health, including the mental health of the health workforce. So I heard burnout earlier. I look into labor market issues such as cross-border mobility. We're having the workers coming from the east to the west, from the south to the north of Europe, and also industrial relations issues such as the European Economic Governance Framework, which if you're from the European Union, you know, maybe as a European semester process there, where governments have to submit plans on how to improve their economic structure and everything. But also I want to focus a little bit of why I'm so interested in hearing from young voices, because that's why we're here. Because during my studies in European public health and also in my master's in international health, I became really much inspired by the ideas of young health professionals wanting to shape the future of the world, or the world in general. And this actually led me, together with other students, young professionals from Sweden, to found the Swedish Network for International Health, where we connected students studying masters in the area of health across Sweden. And then we launched annual conferences where students were able to meet and exchange. So this was really eye-opening to see what students, like-minded professionals like me and you, well, not David, sorry, but we are always we're thinking of. And then also shortly after the formation of the Swedish network, we had the opportunity to work with the Global Health Next Generation Network. And in that context, we built the Global Health Mentorships Program, where we basically connected established professionals in the area of global health from all over the world with young professionals or students that would like to have a career in the area. And just seeing both initiatives, this has been almost, let's say, 6 or 7 years ago, and they're still going, and it really advances the mission of giving a voice to the future of health professionals. It really brings joy, and I'm really, really excited for this. But this is more of my background and my motivation of why I also wanted to join here. At the same time, and that's actually how I got to know Lars, I was the chair of the European Health Parliament Telemedicine and Patient-Centered Care Committee. So I'm shouting out to my committee members. where we developed a policy recommendation to build a more reliable, accessible, and safer system for telemedicine to actually flourish. So now actually coming back to the question that you had on where the European health ecosystem is heading, or well, in my point of view, what actually has to be done to allow health ecosystems to actually emerge and flourish. I'd like to give a few pointers, and some of them, having the pleasure to be the last speakers, most of them have already been touched upon, so please bear with me for some repetition. For me, working in the European Union, I'm working close with the European institutions. I went into the role a little bit of a free spirit and idealist that, yes, we can achieve everything that we set out for. And I was hit with a really hard reality of how proposals, etc., come to the actual table and later on go into the impact on the national level. So for me, the real change really depends on decision makers that have to juggle many different portfolios and different priorities, whereas healthcare is only one of them. So when we are addressing the governments and the policymakers, we really have to take that into account, and we really have to show why our health is really important compared to others, because that's what other sectors do, like the military or education, where education is of course similar to the health part, but looking into military is one good example. So it is therefore, in my point of view, really essential to review the health community's communication tools and approaches, and to learn how to adapt the messaging that you want to convey, the importance of what area in healthcare you really want to advance on the agenda of the politicians, to really develop this and adapt the messaging to the receiver and the decision maker. So right now, what we see or have seen in the past, also through COVID, is that healthcare is mostly seen as an expenditure, so a cost that needs potentially to be cut or reallocated because, you know, politicians have different priorities, and we really always have to see how we can make cuts. But what we really want to see, and this is what I mean by this, how to shift the communication, is that we need to communicate health as a long-term investment. And I think it was also Rosie that pointed this out, that it's a long-term investment, that if government's decision maker would prioritize health, this will have a tremendous effect on other areas of the economy, because we all know a healthy economy, or if you invest in health, the workers that are more healthier can contribute better to the society, and there will be more won't have the sick days, etc., which then again contributes to the driving of the economy. So this is more of an economical perspective that I see is we need to really focus on. As we say, there's not enough money in the healthcare sector or in the area of health. So this is really how you could tackle this and move things along. And now I'm also touching a bit of what Brian has said is on the digital transformation, but I do believe that it's not just the digital transformation that we should focus on, it's also the transformation from moving of one size fits all treatment and disease curing, let's say, to a more patient-centered approach to really hear out the patient, to see what this patient is facing with. Again, as we said before, ranging from the individual perspective, from the family perspective, from the more societal perspective, etc. But then as last part, also preventative rather than treatment. So really focusing on the prevention of actual diseases through a health on all policies, for example, having improved infrastructure in your city, including bike lanes rather than car lanes, or having more designated areas for non-smoking versus smoking, etc. But then going again to the digital transformation, we really have to make use of the available solutions that we have and also foster those that will come up in the future with the transformation. And for that, and again, Brian took the word out of my mouth, is that we need a sound legal framework, as well as digital liberal society and healthcare professionals, where of course healthcare professionals are also part of the society, so we shouldn't really put them in two different pots. And as well the connectivity, so connectivity meaning the internet speed and security, etc. Then another part is, as I said before, the embracing of the vast knowledge from patients and the representatives who have a unique point of view in the management of their disease. And with COVID-19, on the other hand, another topic, with COVID-19, we've seen a breakdown of silos between the healthcare professionals. So that, for example, looking into task shifting, we've seen that, for example, when you had in certain countries that a nurse was only allowed to do certain tasks, but then he or she is now receiving more responsibility, for example, on vaccination. So this is something that is really, really good for the future to also lessen the burden on the healthcare system, but also on the actual hospital, for example. But if we're looking into task systems and just, we developed because we had to, because COVID came up, we don't really have yet the impact of, is this actually sustainable for the future? I know that there's a lot of other things we could talk about now, and I'm happy to take questions later. So if you have any other points later on, I'm happy to answer them. And thank you so much for the opportunity. So I don't know to whom I go back, to David or Lars, but please shoot ahead.
I'm sure Lars will be happy to comment.
Okay.
Yes. One of those days, in all of our many sessions, David, being struck by technical difficulties hasn't actually been one of them. Well, there's a time for everything. And in this case also, Simone and the others, reflecting on your collective input, what you see before you is mostly a lot of challenges that need to be addressed, fixed, done, do something with. And there might be a hint, I suppose, of dystopian elements in Susanna's, but you seem to be hopeful, most of you. And Simone was gone. It was sort of a question. Simone, are you?
Yeah, yes. Sorry. I thought that you wanted to take this to everyone. Sorry. Yes.
Well, it was a question for everyone. So you are welcome, the rest of you, to turn on your cameras too. And I would be very happy if you would contribute also. You have all of you fairly long to-do lists, which is fascinating. It screams of enthusiasm and energy and vitality. And that's wonderful. But it may also be a daunting to-do list for some. But since this is, of course, the decade of action, do you, and maybe that's a question for all five of you, do you feel confident that in these 9 years from now, which is not really the future, that we'll be able to create a sustainable health system? Anyone?
Go on, Rosie. Go ahead.
I'm full of hope, but I have very little faith that in the next 10 years much will happen. I think we can all dream, but I don't know how realistic that is.
Well, it's a wonderful phrase in a way, full of hope, but have little faith. But Nahida?
Echoing Rosie, I'd have to say the same. But I do believe that we can create some change within 9 years, and we've had some changes. And I believe, especially with the creation and move to ICSs, the main focus is actually to see how we can collaborate with local authorities, with GPs, and have more of a representative services for the community. And I'm working that first. I'm working in that with GGI, and I see that. So I think there is definitely hope. And if we get it right with ICSs, then that will be a right direction in serving the community and a better, sustainable healthcare system.
I can come in quickly. I mean, I think I'd echo my fellow panelists here, but in saying that I'm cautiously optimistic. But you know, I'm just seeing us all here today. I've got a lot of faith in our generation to shape a lot of these changes. I think we're seeing a lot of youth doing amazing things, doing a lot of social change. So if anyone's going to be able to do it, it's going to be us. So I am cautiously optimistic, but do have faith.
Woo-ha. Yes, thank you, Brian. And also Susanna, hope, but no faith, or maybe faith,
hope.
but no hope.
Hope, definitely. I really like this cautiously enthusiastic phrase. I'm going to reuse that one. Yeah, I think there is change happening already. I mean, when you look at, for example, it's about the climate, but the whole climate demonstrations in the streets with the people really going every time and showing that we're here and that something needs to change. I think if we do that for other topics as well, that would be great. So yeah, I think there's hope. 9 years is short, but let's see what we can do.
And indeed, Rosie, Susanna, Simone, I think you opted out cautiously enthusiastic, cautiously.
Well, no, I think the cautiously optimistic is a good one. I mean, working in Brussels in the health policy field, being on the the pulse, it can be sometimes very daunting and sometimes very nerve-wracking and exhausting and frustrating and all those negative things. That sounds very bad now, but this is the life of a policy person, that you want to push your agenda, pushing the agenda of the youth to have a voice in the new shaping of the policies, and then we're confronted with the reality of bureaucracy and everything, the way that it goes through. So I'm seeing a lot of nodding heads. I really like this. So this is, I think, the part where we have to be realistic. I'm normally always in for dreaming and everything and reaching our goals and all the yada yada yada. But this is really we really have to be aware that there are existing structures. Of course, we can start a revolution and rebuilding the system. And I read anarchy in one part of the chat. Sure. Of course, this is one way to do it, but we have to be careful with what is the sound way to do it, and to I don't know, being very yada yada dreaming exactly. I think we just have to be cautious the way we are approaching certain things, because we cannot just revamp the system and then expect it to work. So slowly introducing things, it might not take 9 years. I would go maybe for 20 to be quite realistic, just to consider how slow things work. And that's unfortunately the European institutions. Again, I have to be careful what I say here, but that's I'm more of the realistic person instead of dreaming. Dreaming is nice, but dreaming doesn't pay you yet, at least. So that's how it works. Yeah. Sorry for being
cautiously realistic. Okay.
Cautiously realistic. Yes, that's more like
realistic.
Can I just make a point though? I think there are a couple of things I want to tease out from what's been said. I think someone was saying, forgive me if I can remember who said what, but this whole thing about recognizing that health isn't just a cost, but that actually it's a benefit. Again, is something, and someone talked about communicating, messaging better. I think it's very interesting, isn't it? And Susanna brought up the climate change activists and the general sense of a solidarity among younger people about this particular theme. It's how people have been very, very good at selling climate change as something that really matters. If you think about David Attenborough and people like that, there's very strong messaging, and yet it's difficult to imagine. I mean, the health crisis, if you like, the sustainability of health is just as much a burning platform. I mean, it's something really we should be very worried about. And yet to be able to get that message over to people, it seems to me it's much harder than showing animals dying and, you know, various things that are seen as emotive and, you know, quickly get people's attention. I mean, that's a real challenge, isn't it?
I guess the answer here would be yes. But to add also, coming from the comment that you made, Brian, and also the comment you had, Susanna, about the climate strikes, or for that matter, being the generation that can do it, the cautiously optimistic, or at least optimistic of you. Seeing the elements of your generation, and right now I'm painting with a wide brush, but seeing your generation being also slightly more connected in digital means, but in a global culture much more than, I mean, we talked for decades about the global village, and suddenly maybe it's sort of here in a way. Being connected much more. Is that sort of then also what for you, Brian, maybe, or for you, Susanna, what gives that cautiously optimism? Nihida, I think you had it too, of actually having a different kind of power, a different, not necessarily political power, but at least a power of agency, being able to do stuff instead of feeling disconnected or alone. I'm making so much sense that you're just stunned by my wisdom. That's what talking to older generations can do. Sorry, but yes. But do you find that to be comforting or rewarding? I mean, I am working together across time zones, working together across continents.
I mean, I can chime in here really quickly. I mean, how the Commission operates, you know, we work all across the world. And I think a lot of these, you know, work from home, a lot of these remote work settings would not have been possible, you know, if not for the pandemic, actually, because I think it kind of forced us to you know, go into these sort of remote settings. So I think, yes, you know, we are seeing a lot of these changes. We're seeing how important different types, as I mentioned, different types of literacies, you know, these digital, these health, these civic literacies are really important in feeding in a lot of these processes. And I think a lot of that, once we develop those skills, that's really necessary for people to have, especially young people, to have, you know, voice in these spaces. And as you mentioned, Lars, to have agency in a lot of these changes that we are shaping.
Yeah.
Echoing on agency and just honing down on that, I think definitely it's important to have agency, because then it goes back to David's point about taking personal responsibility in terms of looking after yourself, your health. And if the system can provide agency, which they're not doing much of, and we having to do that ourselves, then it's a great thing I think we're doing. And yeah, agency is very, very important, and seeing, especially now, all young people from this panel in itself actually, and having this conversation and having this Health Future Forum, gives me hope that we're starting to reclaim our agency from the system, and tackling these issues that are very much important to us and the coming generation. So, yeah.
Indeed. But I guess I would allow, once again, I'm sorry, David, but I can't help at times. I mean, seeing you are the superior wisdom here, do you also then find hope from these young voices?
So are you asking me?
Yes, I'm asking you, indeed.
Oh my goodness, someone's asking me. Okay, look, of course I do. I think what particularly, I mean, I expect it's my right as an elder to encouraged and stimulated by people who are young and full of energy and so on, and clearly very thoughtful about what's going on here. But I think that what Nahida was saying about agency, I was struck by Simone made the point about how much she's felt a benefit from being part of groups of young people working together and so on. And I think for me, that's a crucial issue, isn't it? That we haven't, my generation really never had to face that. We lived in it felt like a much more secure environment. I mean, things are much more turbulent now, and there's lots of uncomfortable stuff happening that wasn't 50 years ago. But it's why I went back to the point Susanna made about climate action is more than ever, people have to band together to create agency, because it's not going to be offered to them from above, it seems to me. And that's an important lesson for me, I think. It's something in our organization, Lars will agree, we've looked at possible future scenarios, and a big lever there is going to be social action. There's no question. It's not something we would have guessed from the start. Again, we're perhaps too stuck in the medical model, but all the evidence points to the fact it's going to really matter that people work together. It sounds very vague and fluffy, but I think it's actually, in practice, it's something really important we have to understand better and understand how to enable, really. I don't know whether people have any comment on that. Let's finish then by just saying we're very, very grateful for you giving us your time and your opinions. I think we've enjoyed it very much, Lars and I, and I hope you did too. Let's ask Jim to come in now at this point and help us wrap up. Yeah.
Thank you, David. Thank you, Lars, and thank you all, Susanna and Simone, Nahida, Brian, Rosie, for your comments. What's struck me as I've been just listening here is the ambivalence that you kind of indicate, cautiously optimistic and not really expecting much change in the next 10 years and so forth. And I'm reminded of a Pew poll of young people that was released several weeks ago. And I would just wonder, I'd just like to hear from each of you, one of the questions that drew the most media attention was when they asked the young people to comment on what they were expecting in the future. And a majority of the young people, and this was in, I think, 69 countries around the world, felt that the world was heading into a doomsday scenario. So I'd just like to hear from you as we close this session, just because it's such an opportunity. I'd like to hear from each of you how you're viewing the future. We're in a climate emergency, code red for humanity. At the same time, there's a lot of very positive things happening in the world. As Lester Brown says, things are getting better and better, worse and worse, faster and faster. So as each of you look at this world of ours from your unique vantage point, would love to just hear your comment as you look in and you see the future. So starting with Susanna, how would you answer that question? Are we going to survive or are we not?
For me, yeah, it's true that we're headed somewhere that is not very bright. But I think that if we hit a crisis and if we really hit rock bottom, then we can only go up. So I think that the crisis is good because it brings about change. So in the history of economy and humankind in general, every crisis has brought something new to the table. So if we hit this crisis, we will have to reinvent ourselves. So that's my hope for the future.
So you're a cautious optimist. Simone, how about you?
I make it very easy on myself because I actually want to just second what Susanna said. We do see, working myself in the employment field, that the COVID-19 pandemic has also shown some, let's say, positive change and work optimization, particularly in the health sector, on making things, let's say, using more telemedicine and more remote controlling and everything. So there we see that this would not have happened if it wouldn't have been for the pandemic in that sense, and also working more remotely, that this has impacted, and this has really introduced legislation, at least on the European level, on teleworking and digitalization and the right to disconnect, etc., which would not have been so accelerated if it wouldn't have been for the pandemic. So I think these were again, I'm working on employers representative, so if the unions will hear like good things happen out of the COVID pandemic, it's a bit controversial, but this, we have to also see this part. So yeah, I think that would be my take as such. So yeah, thank you very much for all the insight, and yeah, and I'm very sorry for being a little bit negative on this. I think I've been working in this field for too long that I really want to see the change. I just don't see it yet, but I'm cautiously optimistic. Thank you.
Well, I think your pessimism, Simone, is well taken. You know, we've had governments aware of climate change for over 50 years, and they've done essentially nothing. And we are now at a critical moment where scientists are legitimately talking about the possibility of the extinction of our species as we head into increasingly lethal ecological turbulence. So I just wanted to say I appreciate your candor around how you're really feeling. It's a tough time for all of us. I think particularly for young people, because I've got two sons about your all ages, you're around 30. And they're highly ambivalent about how to really navigate through a world that they no longer really understand. And so I think that's real. So I appreciate your comments. Nahida, what would be your general view of the future?
Firstly, such a daunting question to have to think about. But I'd say I agree with Susanna. I think we'll definitely hit a crisis, go into a crisis, which means the younger people or our generation are left to pick the pieces, and then again build up, and hopefully for the coming generation they don't have to experience what we are about to go and experience, which I don't think is very, very great or looking great in all aspects: health, housing, jobs, everything. I know, very pessimistic, but I guess the work has to be done, and we just have to prepare for the crisis that we're about to get ourselves into.
Yeah. In the end, whatever the situation, you've got to do something. That's incumbent upon us as moral beings, and I think the point that you're making, Nahida, is actually quite profound. It's easy to act when the future is certain and bright. It's much more challenging to act when the future is problematic, and there are many reasons to put your head back in the sand. It takes a higher quality of moral rectitude to honor your position as you are. So I just want to acknowledge that. So thank you. Brian.
Go after all these great points, but I think I'll up what Nahida said and say I don't think we're just about to hit a crisis. I think we're currently in a crisis. We're not really going to have, we don't really have a choice. So we do really have to just deal with it if we want to survive. And I think it's a matter of which trajectory we're going to take as society to shape these futures that we're going to be living in. And I'll pull from what Susanna was saying about crisis. And there's this famous Chinese proverb which says, in every crisis lies the seed of opportunity. And I think we've been seeing that quite a lot with pandemic. Simone has pointed out how digitalization has been shaping things, how quickly and radically we've been able to shape change. We've been able to bypass a lot of things because, again, we don't have a choice. We had to go somewhere. We had to make move and make strides forward. So yeah.
Great, thank you. There's no doubt, that we're in a situation where every choice matters. I mean, that's inherent in what you're saying, that we're not heading into a crisis, we're in the crisis. And the crisis is worsening. And therefore, there's no room for even guilty bystanders. We're all in it. And collectively, we're going to be making a very powerful choice as a species, as different nations, and as individuals, as we traverse the next several years in probably the most consequential moment, maybe in all of human history, because we've never encountered before the prospect of species death in a way that we have to deal with it now as a scientific possibility. So that old Chinese proverb, man, maybe the truest thing in the world right now is somehow in this deepening crisis, there's an opportunity and we better find it pretty quickly if we're going to navigate our way through this thicket. So very good point. Thank you. Rosie.
Yeah, I think we live in a very complicated time. I think there are so many positives about how we live right now. We have strength in numbers. We can contact all of these people across the world who think in a similar way that we does, which has this huge impact on us. And I've got so much confidence in our generation, but there's a very pessimistic side of me that thinks, mirroring Brian's point, we're already in this crisis, like the damage is already done. So how much can we do to get us out of this? I don't even know if it's possible. I think so much has also happened, I'm 25, so much has happened in our lifetime. I think a lot of us just have this sense of impending doom that I'm actually not sure if we can get out of. So sorry to end on a really pessimistic note, but yeah, that's how I feel.
Yeah. Well, it's so interesting that this group is especially in Rosie's remark and Brian's and Nahida's is consistent with global polling. That I would say en masse. And David, I think you were making a very important point. I'm with David. I came out of the 60s. I'm a baby boomer. And in those days, there was no sense of impending doom. There was a sense that things were kind of trundling along. And, governments basically had a capacity to ensure stability and normalcy. And that's all been stripped away. And how we now move forward and how we empower you as young people to navigate through this terrain, I feel as a father and as someone who tries to look at the world as realistically as I can, that we need to empower you. And that's one reason why we've formed out of Humanity Rising, the Global Regeneration Corps, not as a separate organization, but as a global call to action at a time of code red to build what we're calling pods, small groups of regeneration first responders to help regenerate the human and planetary ecology at this very fragile and critical moment. And it's basically focused on how we empower young people. So if any of you are interested in knowing more about it or joining in some way, please go to globalregenerationcorps.org and you'll find the information there. And we're focusing on the COP coming up, the Conference of Parties, November 1 through 12 in Glasgow, which is being called the most consequential Conference of Parties in history. It's number 26. And it's all about how we empower youth to take the kind of action required. Because I think what is true, almost incontrovertibly true, is that you young people are now emerging into your adulthood at a time of escalating ecological turbulence, within the context of which our governments are less and less capable of ensuring stability. I think that's just a true statement about planet Earth right now. We see it with COVID. And we see it with climate change. We see it with all kinds of global challenges. Our governments don't seem to have the capacity, even though there's the overwhelming will of the people, to take the kind of action that would enable people to have a sense, whew, kind of we worked through that one and we've got some breathing room. We're no longer in that historical period. And so I just want to acknowledge that, and I think I, in some ways, apologize that my generation was not able. We changed culture. The baby boomers changed culture, but we didn't change politics. And just to say something personally, I came of age, in the 1960s, early 1970s, and it was the flower generation. I mean, it was sex, drugs, and rock and roll. It was acid. It was the pill. It was just this booming sense of possibility. And then John Kennedy was assassinated, and then Robert Kennedy was assassinated, and Martin Luther King and Malcolm X, and the Vietnam War. So we've had this split in human culture, between more and more dynamic, the liberation of women and the gays and all the gender fluidity and the ecological movement, and almost every conceivable issue has dozens, if not hundreds, of NGOs working on it. And yet, objectively, the world situation seems to be getting worse and worse. And how do we collectively, multi-generationally deal with this is a real challenge that requires urgent consideration on the part of all of us as we go into the possibilities of what Code Red actually means. And for example, the possibility that the pandemic is not going to go away. That's also what Code Red means. That the pandemic just won't go away. It becomes a permanent feature. And pandemic upon pandemic, and ecological turbulence upon ecological turbulence. And you still have to live and find meaning and find love and find jobs and find a way to somehow contribute to this. So I just want to, as an elder, along with David and Lars, who's a little younger than David and I, but I just want to appreciate the soulfulness and the integrity and the authenticity with which you've spoken today. It's been very deeply meaningful, and with all my heart, I wish you all well and hope that we can meet down the trail at a happier time as we seize the opportunity out of this crisis. So listen, I know we're way over time, but Lars, I would love to just hear a final word from you, and David, just a final comment out of this rich dialogue today, then we'll close out. Lars?
Well, a final comment would be that this being cautiously optimistic is still essentially being hopeful. Being realistic is nice, planning, but hope springs eternal. Without that, well, it's really hard to do anything. But you also know that you're only really in trouble when you stop acting. As long as you keep acting, as long as you feel that you can actually make a change, you still have a chance of actually, well, finishing whatever you started. I am a very passionate runner myself. I do ultra runs, and the only sort of real lesson here is that to get to the finish line, well, it might take a lot of strife, it might take a lot of pain, but it only happens if you keep at it. So being cautiously optimistic, I'm happy to hear that you're mostly cautiously optimistic, and I hope that you'll join Jim, David, and I somewhere along the trail at some point. Not necessarily running. You can walk.
Thank you, Lars. Powerful words. David?
Yeah, from my point of view, I'm not cautiously optimistic at all. I'm just optimistic in one sense. I have to qualify it, which is, look, we're in this mess partly because humankind is stupid. You know, they've created something that they ought to have seen coming and done something about. You know, but at the same time, it's about resilience, isn't it? My optimism is about recognizing that despite all of that, humankind has got resilience, and I'm not surprised to hear what our invited friends are saying about recognizing there's a crisis and they'll have to deal with it. And I think that's what this is all about. It's a shame things got to this stage, but I have a real firm belief, you know, in the potential of the people around this table, you know, to help get us through. It's as simple as that. You know?
Thank you, David. Thank you, Lars. Let us end on that note that hope springs eternal. And the greatest weakness that we can manifest at this time is not to act. That's not to act. If we don't act, then hope is not embodied. So thank you, everyone. This has been a very powerful session. I'm very moved. I'm very moved by all of you today, and thank you very much. That'll bring us to a close here on Humanity Rising today. Tomorrow, we're going to be speaking with Ray Moody, the great thanatologist, the first person in Western civilization, actually, since in antiquity, who brought the issue of death and dying to public attention through his great work, Life After Life. He'll be with us tomorrow to talk about his latest research on the process of dying and out-of-body experiences and what happens at that liminal moment of great mystery. Ray Moody, that's tomorrow on Humanity Rising. Bye for now. See you tomorrow. Thanks, everyone. Great session.